Hello and welcome to the weekly Dementia Blogs being sponsored by SpectrumMed. As always, I am Dr. David Hutchings, and today we're going to discuss what do all dementias have in common. It's been a question that's actually popped over a couple times, and I've received multiple emails and also questions from my patients as well, because it can get confusing. As practitioners, one of the most often questions we more than likely get is, well, two of them. Number one is Alzheimer's genetic? And number two, what is the difference between Alzheimer's and dementia? And we've discussed that in previous blogs, but in brief, there are about 85 different conditions that can cause an individual to have dementia. Not all forms of dementia are progressive. However, the ones that we all talk about the most, like Alzheimer's disease, certainly is a progressive disease. And as we talked about frontal temporal lobe dementias, we've talked about Parkinson's related dementias, vascular related dementias, so all these are progressive in nature. So what I'll do in terms of an actual, really trying to explain is using the cancer scenario. Okay, so this is kind of a way that I've always explained to patients is that we have this umbrella term for cancer, and we have many different types of cancers that fall under that. So think about the same thing as with dementia. We have an umbrella term called dementia, and you have many forms that fall under that. And we know that the Alzheimer's makes up roughly 70 to 72% of all dementia cases. But the questions that we keep getting is, what do all these dementias have in common? And so I want to discuss what we call the 5 A's today. And this is something we'll see across every form of dementia. Number 1A is amnesia, or the loss of short-term memory. Now, we may see this happen immediately, like we do in Alzheimer's disease, or we'll see maybe later on we'll have cognitive and memory amnesia issues that come later on in dementia. For example, frontal temporal lobe dementia would be a good definition of that. So the amnesia is the one piece of it. Next is aphasia, and aphasia is the loss of language. We have trouble finding words, completing sentences. We may have, speak an entire paragraph that we can just summarize with one words, forgetting names, those repeating conversations, those types of things. That would be the expressive part of aphasia, but then eventually as the disease progresses, the understanding or the receptive language aphasia comes into play where patients have difficulty understanding. The third A is apraxia, and I'm a piano player, so I'll use that for example. Just through motor memory and practice, I'm able to play the piano. Take that same thing into walking, eating, talking, just normal movements of your upper and lower extremities. And it's almost like a cell phone signal. So the brain and the muscles or whatever movement you're trying to make, that cell phone signal is broken. So this is why we see patients who have difficulty speaking, eating, and also we see gait abnormality as a result of that. The next one is agnosia, and this is where patients lose the ability to recognize faces and also places. I have a patient right now that I'm treating, well, several that I'm treating, but one right now that comes to mind, that she's now beginning to lose the ability to recognize who her husband is. Typically, it will happen with great-grandchildren, grandchildren, children, then spouses, kind of in that order. And this is also why we see kind of, getting lost within the home or not knowing your familiar environment as well. And lastly is attention and concentration deficits. We do see attention issues that is separate from memory. Because remember, dementia doesn't only impact memory, it impacts all cognitive and physical abilities. So we do see attention and concentration deficits as well. So again, amnesia, aphasia, apraxia, agnosia, and also attention and concentration deficits is what we see across all forms of dementia. Even though they all progress differently, we treat them differently, and we diagnose them much differently. But those are the commonalities that we'll see. Next week, we're going to start talking more about what to do after the diagnosis, and we're going to go into eating issues. We're going to go into bedtime issues and sundowning and some of those other topics that I know that are incredibly difficult for the patients and also, quite a bit of burden for the caregivers as well. Keep the questions coming. We appreciate all the views, and we will see you again next week. Thank you.